Hi, I'm Keith.
And hi, I'm Sarah, and this is Pain Chat's autocomplete interview.
Hi, my name's Keith Roper, and I work at the University of Utah Emergency Department and specialize in treating people with back pain.
Hi, I'm Sarah Hagg, and I'm a physiotherapist at Entropy Physiotherapy and Wellness in Chicago, Illinois, with a specialty in women's health and with a strong interest in pain. How to lower back pain relief.
The best thing we need to do is stay moving, because most of the time what happens is people freeze, don't they?
It's not going to be the same answer for every person, right? So
Absolutely.
sometimes it's helpful to get a little bit of guidance if you start to run into those movements that hurt more instead of less.
Sometimes it hurts and you're not sure if you should move or not, and so sometimes you need a little bit of extra assistance.
All right, the next question, or the next autocomplete is, how to lower back pain during pregnancy? So back pain in pregnancy is super common, and it's actually kind of the same answer as the first, is to keep moving. So obviously things are changing during pregnancy, but also moving tends to be the best thing for you.
Is there anything else people can do besides just moving?
Honestly, if you're having trouble figuring out how to move and not hurt more, and you're not hurting less either, to seek some help. And sometimes you can modify your activities depending on what's going on with your pregnancy. So medically, if baby's safe and mom is safe, back pain can really be addressed well by a healthcare practitioner, like a physiotherapist. It's kind of fun. All right, how to lower back pain treatment.
So this is an interesting one because there's a lot of variation, isn't there, in what kind of treatment people get.
Yeah.
Really, the best thing when you're looking for treatment is it should be something that's active. We have a tendency in the past for a lot of our back pain treatments to be on the table, passive, us doing things to people. And really what we're finding is that the best treatments are the treatments that the patient is able to be involved in themselves and where they're able to stay active and moving and doing things. There's kind of a common theme there, isn't there?
There really is.
Yeah.
And really, I mean, because treatment, some people used to think about going to the office to get treatment, when really what we're finding is that this person needs to be doing their treatment, if that's what we want to call it, out in life every day.
Absolutely.
So kind of having that application to real life, not just that 30 minutes with a practitioner.
Yeah, that's great.
Okay. All righty, the next question. Oh, how to exercise with low back pain. Wow, it just depends on what you like, I think. So the biggest thing, I think, when people are like, what exercise is the best for low back pain? My next question for them is, what do you like to do? Because we've already established with the first ones is that moving is really good. We know it's even better if you like it.
One of the things I always tell people is there's two critical factors in an exercise. Is it available, and do you like to do it?
Right.
And because if those two things aren't there, then you're not going to do a very good job. But if it's accessible and you enjoy it, it's probably going to be good.
Yeah, and I think that's something that's like simple but not necessarily easy. Finding that thing that you like to do, want to do, and will actually do, and then taking a look back to see how it's making you feel.
Yeah, definitely.
Awesome. Okay.
All right, what's our last one?
Last one.
Ooh.
How to fix low back pain.
How to fix low back pain. I'm not really sure that we can fix it, per se, because it's not necessarily a problem in our function or our structure. It's really about how we perceive the problem. And if we really focus on getting back to our life again rather than focusing on the pain, perhaps that's the better approach to take.
I agree. I'm not sure that can be a thing. There was just recently a great article in, I think, The Independent that talked about low back pain maybe being more like sadness or even hunger, like something that we're probably gonna, or being tired. It's something we're probably gonna experience, but not necessarily that anything that's wrong, but also something that's going to pass.
But it's tricky because we have a tendency to think that something's broken, needs to be fixed, but very often pain is not really a result of something being broken and therefore doesn't need to be fixed.
Yeah, so I think I think with all of these things, again, there was like a common trend of getting moving and that you're not broken, but also when you're looking for help, it can be kind of hard to find good information that is really helpful and also accurate. So a great place to go for that is Pain Chats.